Good morning, all of you. Myself, Savita. Today's my topic is childbirth stages and yoga for healthy baby birth. So first, my sincere gratitude to my guru, Dr. Subhash Indira Marleva, who is a gynae, and Dr. Nutan Pakhare ma'am. Both are the background of yoga and Ayurveda. So with the help, Dr. Marleva helped me during my both delivery, my childbirth, and Dr. Nutan Pakhare ma'am now helped me after my childbirth to upgrade my knowledge. And I really thankful to my family members also. Moving forward, my topic is childbirth. So childbirth in Ayurveda called prasava. Childbirth is a natural process of delivering mature fetus, umbilical cord, and placenta from the uterus on expected time without any complication. So process of this giving birth starts inside the womb and it's called prasava. The word prasava in Sanskrit derived from Shuyana Prane Prasave, that refers to labor, and the term labor in Latin means to suffer. That's why when the pregnancy delivery comes near, everyone tell them labor pain starts. Expected. So when expected time of fetus completed, labor pain starts naturally. This act means birth of child as well as mother also. I had two child, so I feel I go through this experience. According to Ayurveda, prasava can also referred as the Garbhamochan, Garbhamukti, and Garbhatyaga. It means physical detachment of the placenta from the womb. Now, prasava kala. Different acharyas suggest different prasava kala in months, like Charak, Sushrut, Vagbhat, Kashyap, Harit, Chakrapani, Bhava, Prakash. They are mentioned 9 to 12 months of prasava kala. In modern science, the time period for normal delivery happens after completion of 36 to 40 weeks. Premature delivery period is before completion of 36 weeks, and post-mature delivery time is after completion of 40 weeks. My first delivery happened a premature delivery. 7 months. I just deliver my first baby, and my second baby comes after 40 weeks. So second delivery is my normal. Now, sign and symptoms of prasava. So when your time is complete, you feel then your energy level is changed. You feel tired. You feel lightning. You feel again and again go to washroom, and because of baby drop down to the pelvic. Some show bloody mucus discharge from the cervix because of dilation. You feel some back pain because thinning of the cervix. Your water breaking, garbhodak or amniotic sac rupture. You start your contraction. In this process, the cramps every 20-30 minutes happen. Gradually, it's stronger and active labor phase starts. This is the sign. Then you need to go to the hospital. Now, the true labor and fall labor, you have to understand what is the true labor signs. In the true labor, the contraction are regular in every 8 minutes. Each contraction is felt starting at the lower back, radiating around to the front, low in the groin. A change in activity or position will not slow or stop contraction. In false labor, the contraction are irregular. It happens sometimes 10 minutes, 6 minutes, or sometimes in 2 minutes also. Contraction are felt as a generalized abdominal tightening, and in false labor, a change in activity or position may cause contraction to slow or stop. Stages of prasava. Acharya Sushrut define the stages like prajayini. It starts 1 or 2 days before labor, and the upasthik prasava phase starts beginning the stage of prasava. Acharya Charak suggests prajanan kala abhimatha. It happens first stage before prasava. And Parivritta Garbha is the second stage of complete rotation of the fetus in the womb at the time of labor. Acharya Vagbhat defines Asan Prasav as first stage before prasava, and Apra Prasav. It is a stage of detachment of the placenta from the uterus. It is as per according to Ayurveda. For modern science, defines 3 stages of childbirth. This process starts with contraction and consists of 3 stages. In the future, you can see these 3 stages clearly. The first stage is dilation of cervix, right side The first picture explain about the fetal exclusion, and in the last you can see the placenta delivery. This time it takes to give the birth varies from woman to woman. First stage, dilation of cervix. It is the opening of cervix during childbirth or miscarriage, induced abortion, and gynecological surgery. This stage starts with 4 centimeter of dilation and complete after 10 centimeter of dilation of the cervix. In right side of the picture, you can see in first picture, there is no dilation start. In second picture, the dilation start with 4 centimeter, and in the last picture, the complete dilation is happened till 10 centimeter. So in the active phase of dilation stage, water breaks at any stage. The time of this duration is 12 to 14 hours. Second stage, after cervical dilation is complete, the feces come out in the vaginal canal with or without maternal pushing effect. Yesterday, Dr. Soumya ma'am just explained, then in US, there is no pushing treatment happen. Everyone just wait for natural process. In this second stage, these processes happen when baby come out. This fetus passes through the birth canal via 7 movements, known as a cardinal movement. This includes engagement, descent, flexion, internal rotation, extension, external rotation, and exclusion. These stages take a time to 2 to 4 hours. When the baby delivers, third stage of labor start of the separation of placenta. It is a hallmark by 3 cardinal signs. Right side, you can see the placenta picture, including a gush of blood at the vaginal, lengthening of the umbilical cord, and a gallbladder slit uterine fund in the palpation. Time of this duration is 5 to 13 minutes. Sometimes it happens 15 to 13 minutes. Now, as Dr. Nutan ma'am suggests, 4 important P's during childbirth, I mentioned here. First P is power. During the childbirth, women have the tremendous power to deal with the labor pain consciously. So the passage. Second P is passage. Our cervical or vaginal passage to baby come out. So this passage we can strengthen it to the some Ayurvedic treatment. Like in my second time and first delivery also, I take Ayurved treatment help, and some pichu, yoni pichu, doctor just take in my vaginal area to smoothen this area, and the process of babies come out is very smoother. Passenger, like child is the passenger who come out from the last stage, and in paying attention when the baby come out, every mother have to take the attention on breathing techniques for better oxygenation. So she can practice deep inhalation or exhalation like Dirgha Shwasan. When you inhale, your abdomen bulging up, and as you exhale, your abdomen sinking down. So she can practice deep inhalation, purposefully breathing to cool down the mind, and Lamsi breathing to just relax her mind. Some positive affirmation mantra chanting also can produce high energy to help to maintain her mental state. The most important is surrender to supreme consciousness is most important, because this time some things not happen in her hand or even can doctor's hand. Only supreme consciousness can help her. Prenatal yoga. So labor or deliver to baby is like an examination of pregnant women. It is a painful process, but after finish this exam, means results come when baby comes out, she flies is in the heaven. As Acharya Kashyap says, when the delivery phase is, every woman is like a Ihaloka. His one leg is Ihaloka and other leg is Yamaloka. She can feel these both exercises, some painful situation and happy process also. So during pregnancy, she starts her exercise with walking, and just start continuously with the prenatal yoga. Before start the practice, she must consult with doctor or any yoga therapist, so they can advise which practice according to pregnancy condition she can do. Some asanas she can't require, like bending forward or back bending, but some practices can help her for normal delivery. Here are some pictures, like here I mentioned Konasan, Utkatasana, Bhadrasan, Vakrasana, Shashankasana, Yastikasana. It is a stretching full body. Parivritta Janu Shirshasana, Malasana, very good practice for the pelvic floor. Parvatasana, Marjarasana, Setu Bandasana, Anand Balasana, and deep breathing. I mentioned here my one case study. I practice in RA Podar Ayurved Hospital, and there are one case come from the gynec department in 28 weeks, the bridge position. So I suggest just her Setu Bandasana with support of 2 pillows, Marjarasana pose and Parvatasana pose. So with this position, her baby's head position is changing from upward to outward. Before that, she is little tense, but when he admitted hospital and practiced under the guidance of this exercise, the baby's position has been changed. So yoga definitely helps for healthy childbirth. Yoga also helps in normal delivery, reducing pain, strengthening pelvic area, strengthening lower back, torso, and spinal muscle. These practices also stretches chest. So chest opening muscle also helps for better respiratory. This practice also helps to increase mobility of hip joint, because when baby come out, hip joint movement is most important. The improve of blood circulation in the lower abdomen is improving, reducing her fatigue. And the important thing is yoga develop mental and physical balance, which will be needed during the labor. Now things to remember. As Freeman Dyson said, the pain of childbirth is not remembered. It's the child that's remembered. We can see the pictures, which is my both kids. Right side, my elder child, Yatha, and left side, my little child, Mo. Both comes in Ayurveda and yoga treatment. In both pregnancy, I just practice yoga and Ayurveda under the guidance of Dr. Ayurved practitioner. Here I mentioned, like yesterday, Anusha mentioned, ma'am's AYG Academy tagline, then we create and we cultivate. So here I want to mention, then Dr. Nutan ma'am create awareness through her different courses and cultivate next brilliant generation. So now from today onwards, all of us is on mission. Dr. Nutan ma'am is on mission Suprajanan. So from today onwards, we all of us also follow her path. So I thank you to all my teachers and gurus who made me what I am, especially Dr. Nutan Pakhare ma'am, Maya ma'am, Hezul ma'am, Smita ma'am, give a knowledgeable thing to me, and to all my students and kids who teach me a lot, like Yatharth and my family. I thank you all of you. And thank you all of you for listening to me. Thank you.